Hi, my name is Casey. I'm 18 years old, a student, and I'm into modeling and pageantry at the same time. As a model, it's essential for us to really take care of ourselves, and that includes how we carry ourselves, how we are able to be confident in front of everyone or in front of the stage, and majorly our appearances and the face too. So I'm here to ask Doctora for enhancement or enhancing what I already have on my face. And since I'll be needing it for my career.
Good day everyone, welcome to the Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we have a new guest, a very young 18-year-old from Mabalacat City. Let's all welcome Miss Casey.
Hi everyone.
Ayan. So Casey, very young, 18 years old, very beautiful. And are you still in school, Casey?
Yes po.
Okay, so ano na, college or?
I'm still a senior high school student po.
Okay. Oh yeah, oo nga, 18, graduating from grade, ano na pala tayo ngayon, up to grade 12.
Grade 12 na po.
Yeah. And looking at Casey, okay, still a baby face. And sometimes we say pag baby face, parang medyo may mga baby fats pa, yung parang ganon. And 18 years old siya, so parang yung face contour niya, parang sa ano pa rin, yung younger generation pa rin. Now, if we ask you, Casey, ano yung pinaka-concern mo sa face?
I think po yung chin.
Okay,
Talaga,
yes.
and the nose din. Pero more po yung sa chin talaga kasi.
Right.
Pagka mini-makeupan po ako, although naka-contour,
Yes.
still lacks po dito talaga.
Yes. Okay, so that's a very good thing that you have mentioned. Yung lower third of the face of Casey, I was looking at her. Actually, there's a lack of a vertical dimension dito sa lower third ng kanyang face. Now, whenever we do face mapping or assessment, we do the thirds, yung upper, middle, lower third. So, upper third, she has a very good forehead region. Napakaganda ng fullness ng forehead region. And then pagdating sa mid-face, I could say na she has a very good cheekbone also. And then actually sa mid-face, I noticed lang yung sunken under eye. Siguro laging puyat. Okay. And then part na rin dun sa kanyang nasal projection is very beautiful. Sa tip lang, medyo we wanted to highlight pa yung kanyang nasal tip. Right? Kasi the bridge is already beautiful eh. We just wanted to have a better projection ng kanyang nasal tip. Now, when we go to the lower third of the face, yun na nga, itong kanyang height ng kanyang chin area. Kasi the rule here is 1/3, 2/3 rule. So, kung dito 1/3 size, dito dapat 2/3. So, we wanted to somehow make it enter that right dimension. Then, we also have the so-called yung mga rickets line where we assess on the lateral view, like yung tip ng nose and then yung lower lip. So, yung chin talaga natin, it lacks projection. So, kailangan natin siyang bigyan ng magandang forward projection, anterior projection sa kanyang lower chin. Aside from elongating it, we also need to somehow make it forward like this. Okay? So, tama ba yung explanation ko, Casey? You think it's
Yes,
the right, okay, the right explanation? And also, I was looking at the lower third of Casey. Well, for some women, they wanna have yung narrower yung shape ng face, right? But for some females, meron yung maganda rin sa kanila yung pagiging parang, or I should say, may lumalabas yung contour ng kanilang jaw dito, yung angle of the jaw, lalo na kung magmo-model si Casey. I think you're into modeling or beauty pageants. Some women wanted to have this very prominent angle dito sa part nito. Actually, she has that maganda. But then, I was assessing a while ago, actually. I was touching yung masseter ni Casey. Sige, bite. Yan. So, medyo strong yung kanyang masseter muscle or the chewing muscles. So, for some women, they wanted to have a smaller or narrower chewing muscles. Then, one of the treatment nga is to inject Botox for that part to slim it or narrow it. Okay, or I also advise some of the ladies, ibawasan yung pag-chew ng maraming yung mga nuts or yung laging naka-chewing gum or laging kumakain ng mga, like for example, mahilig ka ba sa steak or meat?
Yes po.
Yon. Yung mga nagaraya cracker nuts, balitog, yan. So, kung gusto natin talaga mag-slim ito, medyo yung chewing muscles, i-reduce natin yung paggalaw or masyadong pagmuya. Okay? So, what we're gonna do for Casey today is to enhance the nose and also the chin part. Okay? Probably, in the coming episodes, pwede nating pang i-contour yung kanyang face, make it narrower, slimmer. You think you like that too? Kasi, actually, for some younger generations right now, they want na mas maliit ang mukha. They want a slimmer or narrower face or yung V contour, yung V shape. Okay? So, what we will be doing for Casey is a non-surgical procedure for nose enhancement and chin enhancement sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So, we have with us Casey. Okay, we're doing the so-called non-surgical nose enhancement as well as chin enhancement. Now, the product that we will be using is the so-called Radius Dermal Filler. It's made of the calcium hydroxyl apatite. Okay, so we start doing the nasal enhancement by applying first a topical numbing cream. And then after numbing the skin, okay, I still have to inject like a 0.1 of this lidocaine into the entry point. So, I'll pinch this tip of the nose. Okay, inhale, exhale lang, Casey. And then about 0.1 at the entry point. Okay. Okay lang? Okay, so that's the lidocaine. And then after that, we have to make an entry point for the entrance of our radius. So, point of entry will be the so-called infratip region. So, the area is already very numb. And then we have here the Radius Dermal Filler. I'm using a cannula gauge 25 around 40 millimeter length. Okay. So, I need to pinch lang yung nose tip. Okay, Casey? So, inhale, exhale lang. And then this is the cannula entering into this puncture area. And then, we'll be pushing this towards the bridge radix of the nose. Okay? So, inhale, exhale lang. So, I'll just be gentle. Just gonna be very gentle for Casey, okay? So, she's just 18. Actually, the nasal tip has some of the oil glands or other soft tissues. So, we just have to be very, very careful in entering our cannula. Sorry, okay? Yan. So, actually, numb naman yung tip, so it's tolerable naman, or Casey doesn't feel anything. Now, I'm gonna pinch the bridge part for the entry further of the cannula, okay? Exhale lang, ha? So, I'm just gonna glide it. Okay. The anatomical plane Actually, it's a deeper anatomical plane. Preferably, we're on top of the nasal bone and the nasal cartilage here. So I'm already in the radix part. And then I'll be pushing this radix dermal filler. To push this, it should be very gentle push. Okay? So dahan-dahan lang ako, Casey. Okay? So the filler also has a lidocaine. Mas numb pa niyan. So there will be no discomfort for Casey. Actually, Casey already has a very good nasal bridge. We're just contouring it or enhancing it. Okay? Yan. So, nakasmile pa si Casey. So, okay lang siya. So, minimal amount of radius on the bridge to just project and enhance. Okay. So, after that, we'll be working on the columella and the anterior nasal spine. So, I just need to make another entry point for that to be able to deliver my filler product into that space between the septal cartilage. So, I'm using a gauge 19 needle for my point of entry. So, it's very important to be staying midline. Okay, there you go. So, again, I'm using the radius. And then, we need to push this towards the anterior nasal spine. Okay, pressure lang, Casey, okay? Pressure lang, pressure lang. We're not in a hurry. Okay. Now, I have felt the anterior nasal spine, so I'll be pushing gently our dermal filler. So, the goal is to lift the tip and project the columella, or yung tinatawag na tip columella show. So, later on, Casey, it's normal to feel na nagnanumb yung upper lip and upper gum because this radius has a lidocaine. Okay? So, I'm already seeing a lifting, instant lift. Kakaroon na siya ng projection. So, I'm pushing in like around 0.3. Okay, so the bridge you can use around 0.5. Okay. So, we can just be doing a molding maneuver on the bridge part. Take note, the filler has a so-called carrier gel, a so-called CMC gel, and with it, it has these crystals of calcium phosphates. Okay. This kind of filler is very biocompatible. It's gonna blend and bind inside our tissues. And at the same time, they are biostimulators. So, Casey, over time, nagbi-build up ka ng mga natural connective tissue matrix sa loob ng nose. That's why we say that radius has this longer lasting effect. Yes. So, parang natural protein tissues magpo-form. Very important to also mold the filler gel onto the bridge. Okay, actually, instant yung result. I'm already seeing a better contour of the bridge, and there's some elevation already. Now, I wanted to have a better projection, so I'll add more. I can still add more para talagang maging pointy. So, I'm using the entry point at the tip. Okay. So, actually, may numbness na, no, Casey? So, I wanted to project more. I'll add again onto the anterior nasal spine. Okay, inhale, exhale lang, ha? So, there's a pressure there. Okay, there you go. So, we'll push a little bit more around 0.2. 0.1 already, and then another 0.1 and another 0.1. Okay, there you go. Wow, I can already see the columella and the tip already had risen, and it's a better shape. It's better because the alar was also pulled upwards. So parang nag-alar reduction ka rin. So we're done with the nose enhancement. We're proceeding to the chin enhancement. So I'm using also our radius dermal filler. And then the goal here is anterior projection and also elongation. Now we'll start with the anterior projection. Okay. So a while ago we had the rickets line and we had seen that there's a lack of the projection. So we wanted to volumize her chin. Okay, and ideally you go at the midline. Okay. And then ideally also you have to go direct onto the mentalis bone. And then before pushing the product, it's ideal to withdraw also a bit. And it's negative for any blood flow or backflow. And then push the product. Okay. So ang radius dermal filler, it's a very good chin filler because it's longer lasting, plus it has these calcium phosphates that are natural minerals. So this has been studied. It's very safe. It's very biocompatible. It will really help our natural tissues to develop new connective tissue matrix. So meron siyang pang-stimulate din ng natural cell renewal system natin. So Casey is just 18. So again, our products are clinically proven safe. Okay ka lang, Casey? Okay, actually, I can start with some 0.3 mil first. And then I'll proceed with some elongation. Okay, with the elongation, I have to direct the needle towards the so-called symphysis menti here onto the bone. Okay. So I have to reach for that bony part. Okay, there you go. So some discomfort lang, Casey, ha, pag natatouch yung bony part. Okay, I'm pushing already. So this is a whitish material. Okay. And it's very good in giving that natural contour sa ating mukha. It has a versatile feeling, volumizing, and also for face rejuvenation. Okay. Because it also stimulates collagen formation. So habang tumatagal, nagbi-build up ng bagong collagen ang ating tissues. So I can still further elongate. I have more of my radius, another 0.3. So kailangan pa nating i-elongate yung kanyang chin. And then over time, this will still plump up. So mapapansin mo pa, Casey, habang tumatagal, mas nagkakaroon pa ng build up ng laman sa loob. Okay? So there you go. So we're pushing in a remaining 0.3 of my radius. So we use a total of 0.9. Okay. So I think we'll reassess the result. Ating ipakita kay Casey ang kinalabasan ng kanyang procedure ng chin and nose enhancement sa pagbabalik ng CSA Certified Skin Authority. And we're back, mga ka-CSA. So we are now at the part of showing the result to Casey. So, Casey, ito na ang ating magic mirror. Okay, I'll hand it to you right now. And look at that. Right? I got so excited po, mga ka-CSA, for Casey. She's beautiful, becoming more beautiful. Well-enhanced nose, well-enhanced chin, very natural looking, and actually parang wala ngang kapasa-pasa or whatsoever, with a single entry point for our nose tip and also single entry point for the nose bridge. And also, like a few entry points for the chin enhancement only. And I'm so happy for her. And parang lalong mas nag-shape and contour pa yung face niya with the projection of the center of the face, which is the nose and the chin. Right? And kung titignan ko yung rickets line niya sa side view, ano na siya, balance na siya. Yung rickets line, pag tinitignan from tip of the nose, the lower lip, and the chin, it's already aligned. And I like her new radix. It's so defined. Para lang siyang naka-nose line contour. And also the nose tip projection. Very good. Very good naso-labial angle here. And later on, I'll still add yung tinatawag na Aller Botox para mas mag-narrow pa yung sides ng ilong ni Casey. Para talagang maging feminine nose, narrower nose, pointy nose, well-shaped, well-enhanced, well-contoured nose, as well as the chin part. Okay, so Casey, ano ang comment mo?
Masasabi ko lang po talaga during the procedure, hindi po talaga masakit. Yung, as in, sobrang gaan po ng kamay ni Doktora.
Thank you.
And yun nga po, sobrang minimal lang po ng pain na naramdaman ko.
Right.
Since may anesthesia din naman po. And unti-unti rin po kasing hindi yung biglaan lang ganun. And
Right.
the result, grabe.
You look
Parang
gorgeous.
little to no pain lang, pero the result is
Wow.
wow.
Right. Yeah. I could say, so it gave an instant nose and chin enhancement. Very natural looking po. And of course, clinically safe talaga to. Then wala to yung parang mga delikadong mangyayari sa face natin. Okay, take note lang po sa mga nakakapanood po ng aming mga YouTube videos, lahat po ng presentation namin, they should be done by certified aesthetic doctors, aesthetic dermatologists, aesthetic surgeons po. Hindi po ito basta-basta ginagawa. Dahil po kung may gumawa na hindi po doktor at hindi trained, problems or complications may happen po. Yun lang po yung warning namin sa inyo. So, make sure that your doctor is certified and trained to do radius, nose, and chin enhancement. So, importante yun. Right, Casey?
Opo.
Safety first. Okay, we're so happy for you.
And I'm so happy with the result as well po.
Exactly.
Thank you so much po.
Okay, do you have any question, Casey, before we say goodbye to them?
Wala naman po.
Yes.
Yung gusto ko lang po siguro is itanong yung how long po ba?
Ang result?
Yes.
Yes, that's a very good question. Because the radius, they have studied it. Nagtatagal yung radius mismo, yung product, about 18 months to even 24 months. But we have reports na even more than 24 months, they still see the result. Kasi yung longer lasting is the biostimulation. Yung nagkakaroon siya ng tissue buildup. Yun yung nagtatagal po. So when we say radius, we call the radius a semi-permanent dermal filler. As compared to the hyaluronic fillers, shorter term yung mga hyaluronic, but the radius it has a longer duration in terms of the effect. The others are asking me, ano po yung bawal after this? Unang-una po, wag mo nang matulog na nakataba. Don't nakadapang tulog, okay? And of course, in terms of the food, they're asking me, well, I tell them, avoid mo na malalansa. And then for some cases, we give mga prophylaxis, antibacterial. Kung meron man pain, just take any analgesics. Kung wala lang, just do cold compress. And then, no heavy, strenuous activities muna for the meantime. And then, usually, mga 2 to 3 days, some discomfort lang because of the injection, mga soft tissue swelling, but it's not that too much naman na soft tissue swelling with this kind of radius dermal filler. Ayan. And habang tumatagal pa, mas gumaganda pa yung shape ng nose at saka ng chin. Mas nagkakaroon pa ng contour, mas may development pang nangyayari sa loob. And further improvement with this radius dermal filler. Okay? Thank you so much, Casey.
Thank you din po.
O yan. Sa inyo rin po, maraming salamat po sa inyong panonood. Kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com or send us a message at our FB page, CSA Derm Centre, or our Instagram, CSA Derm Centre. Ang aming clinic ay matatagpuan dito sa 2nd floor, Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. And I think magkakaroon po kami ng isang clinic pa, will announce kung saan po kami mag-move. So ngayon pa lang po, we're trying to inform our clients, our patients that we might transfer to a newer clinic po. Okay, thank you so much po. Yung mga iba naming mga videos nasa aming YouTube channel, only type Contessa Salvador, and please do not forget to click like and subscribe as well. Okay, again, thank you Casey, thank you sa aking mga assistants, Maurice and Sandra, and also our CSA staff. Thank you so much po. And when it comes to natural beauty, you can trust the CSA Certified Skin Authority.